Well, welcome everyone to this week's episode of Moms in the Middle. We are so excited for today. It's going to be a juicy topic. So I will let Heidi
Yeah.
introduce our guest.
So we have Bethany Peterson with us here today. Hey, Bethany.
Hello. So good to be here.
Yeah, thank you so much for coming on. So Bethany is a pelvic floor physical therapist, which I know we had an episode with the pelvic floor physical therapist before, but we are going to be talking about a different topic with Bethany. We're going to be talking about, well, let me start with a content warning before I say what we're talking about. So moms can turn this off.
I did say it was juicy.
Yeah, that's true. We're going to have adult conversation today. And so if you have little kids around, maybe pop in your earbuds or turn it off and listen at another time. But I'm going to have to sing the song. We're talking about sex, baby. We're talking about you and me. I'm like, there's no way I'm going to get through this episode. That song was like playing in my head all morning.
It's perfect. Exactly.
Yeah.
That is what we are talking about. That is what we are talking about today.
So we're going to talk about sexual health, sexual wellness, sex drive, particularly around the pregnancy, prenatal, postpartum years. And we're just going to get all the insight from Bethany, who doesn't mind talking about that stuff.
Nope, not at all.
Yeah, we thought it was a great month to do it. It's the month of love and a lot of conversation around that type of stuff. So We'll dive in. So Bethany, can you kind of give us a little bit of an intro about how you kind of got into what you do now and why you're interested in focusing on like sexual health and sexual education?
Yeah. So I'm a pelvic floor physical therapist. I started my own business in 2020. Really, when I was postpartum out of necessity, because I had a lot of postpartum pelvic floor symptoms, one of them being pain with sex, which I had actually experienced before. Like whenever I first started having sex, I had a lot of pain at first, but I just like didn't know that was not normal. So I just kind of like powered through. And then that kind of came back postpartum, and I had other symptoms along with that. And I had a scheduled C-section because my daughter was breech. And so kind of all the things that you hear of like, oh, well, you had a C-section, so you shouldn't have any pelvic floor issues. I didn't labor at all of those things. And I still had all of these classic pelvic floor symptoms like incontinence and pain with sex, all of those things. And so I really kind of like wasn't loving how most postpartum care was handled. You have one visit with your OB. And so that's kind of when I started my business, did more research, and really chose like the type of practice that I have today because I felt like it was really important. So that's kind of how I got.
Wish you had.
Yes, exactly. Yeah. And I just love, it's such like a vulnerable time and hard, like you're trying to take care of a kid, you're trying to take care of yourself. It's just like a hard season to navigate that I feel like, I mean, it gets talked about, and now that I'm in this world, I'm like, okay, we're talking about it more. And I hear that talked about a lot more, but it just feels like when you're first in it, you're like, no one told me. So
I think I see that a lot of people, like you feel like as like a doula or whatever, I'm like, how do you not know this? Because I'm in the world 24/7, but then like other people are on the outside and don't know that there's those resources, which is why it's just so important to continue educating and talking about what's normal. I find that a lot of times with our first time moms, they don't know that what they're experiencing is abnormal, that it's maybe it's common, but it's not something that should be happening to them during their pregnancy and their birth experience. Yeah. So why kind of, so I know you teach a sexual education class that's kind of about with parents, like how to have these conversations with your kids. What kind of got you interested in educating a lot of our generation about sexual health and how to promote positive sexual health with their growing kids? Because I know that's something I'm so interested in, just learning about, like how to have these conversations with our children. And I know for us, it was like, I don't know about you, Ellie, but for me, it was like a one-time conversation of like you sit down and you have the talk. And I just have been really interested in it being more of like a gradual, like normal thing to talk about with my children versus like that kind of stigmatized thing. And so, I'm interested to hear kind of how you got interested in that and involved.
And to be honest, I don't remember even having a talk.
Yeah.
Like maybe it was like a slow gradual thing. I don't remember there being like tons of shame, but it was also like, don't have sex.
So did you learn about sex in school then, Ellie, or like from your parents just more gradually?
Yeah, I mean, I guess it was probably just school, and like I really feel like majority of the narrative, and maybe I'm just remembering it wrong, I don't know, but like was just like, don't have sex, don't get pregnant, and then like, I got put on birth control because I was like had a boyfriend who is now my husband who is older than me, and so it was like the worry that was going to happen.
Yeah.
But aside from that, there was really nothing else.
Yeah, ours was, I feel like, so my sex ed was literally just like, these are the mechanics of sex and nothing else. Like no other, I remember my sister, so I have an older sister, and she told me after the sex talk, she was like, in a year, I'm going to give you the real sex talk. Like after I did my sex talk, I'm like, and she told me about like oral and hand jobs, like all the things. And
Amazing.
she was like, because that's not all that there is to like sex, And, but she had to learn the hard way of like being in school and people saying things that she didn't understand. And then, and then you just get so much misinformation from like other kids and stuff. And then, but I grew up, as a Christian in like the heart of purity culture. And so a lot of the only thing I heard about sex outside of the like one time talk about the mechanics of sex was like, don't do it. When you're married, it's really good. When you're not married, it's really bad. Like down to like, we had like at youth group, like wrapped the present. And they were like, every time you hold a hand or kiss a boy, you have to unwrap your present. Bethany making a face. And then like on your wedding night, whatever you have left of your present is like what you have to give your husband. And that just like looking back, I'm like, that's disgusting.
It's so bad.
Oh, it's so cringy.
I know. And as an adult now, it's like, I feel like my husband didn't care that much as like an adult about like how much of a wrapped present like I gave him.
My husband was like, what are you talking about?
Oh my God.
So going back from that and trying to like figure out now, how do I do things differently with my kids? Like I'm assuming maybe that was similar. Like you think people should be doing things differently than how we grew up, or I don't know. So you can talk now, Bethany. Sorry.
Yeah, it kind of all started. It kind of started with like, I always start each session with like, I'm just going to show this, but I always start each session with like showing, except for it's all going to come apart right now, but
it's okay.
with showing everyone like my patient their pelvic floor. So in doing like an anatomy lesson, and the number of people who just like honestly didn't know where their clitoris was, where everything was located, where their perineum is, pregnant, postpartum, like menopausal, it doesn't matter along the spectrum. The number of people that I just am like, this is where your vagina is, this is your vulva, which like the vulva, if you are listening and don't know, the vulva is like the whole structure, urethra, vagina, clitoris, like labias, everything together is your vulva. And then the vagina is the specific vaginal opening. Basically, I always have to start with that education. And that really, like, I realized how much of an education gap there was there. And then that leads into, I treat a lot of pain with sex. And the number of like women I have to tell like that their pleasure is important is so, like, pleasure is a direct, like a reward cycle for our brain. So if we're having pain plus we're not having pleasure, that like directly impacts your sex drive. Which like makes sense, right? Like you're not going to run on a sprained ankle. Like if you take like the intimacy part of it out, like you're not going to, run on a sprained ankle. You're not going to exercise or like do something else that's like painful, or you're getting like a negative feedback loop for. So that also is true with sex. So I always have to like tell women, especially, like, your pleasure is directly related to how much you want to have sex. And so if your partner and you are not prioritizing your pleasure, that does impact you. And they're like, it just like doesn't click, you know. Like, one of my first, like, I feel like a big revelation for people is always like, you wouldn't even think about having sex if your partner, typically in heterosexual couples, like a male partner, if your partner wasn't aroused, you wouldn't even think about it, because they have like a visual representation of like what arousal looks like. But like, we do it all the time. Like, we try and have sex all the time when we're not aroused. So sorry, just getting like right into the nitty gritty of all saying all the words.
Totally.
But,
that's what we're here for.
Yeah. So that was a huge, like, that's a big conversation I have in clinic. And so then, looking at like purity culture, I grew up in purity culture too. If you grew up religious at all, it doesn't matter what your religion is. If you grew up religious, you have, you're 3 times as likely to have pain with sex, later in life, because of like the messaging that you get. So anyway, most of the people that I treat for pain or sexual dysfunction have a religious background or have had messaging around sex that wasn't like positive and like, this is a great thing, because we're trying to prevent, you know, unwanted pregnancies, which is completely valid. But when you really look at the research, there's so much research around like educating, even like little kids, like with my daughter, like the sex talk shouldn't be like the talk. It should be like this gradual, like, information, age appropriate information. Like, my daughter refers to her vulva as a vulva. She doesn't say, although the most hilarious story is that I'm like very strict about body parts and like what they're called. And she refuses to call it her vulva, and she still calls it her front butt.
Oh goodness.
I'm like, well, it's not because of me. That's on you, girl.
Zoe thinks it's funny. That's what every little kid does. I know that's something
at least she knows what it is.
Yes.
That's true. That's true. Yeah, I know we focused on that a lot. Like, I know my mom always had just like silly name, like, you know, silly names for all of like her body parts and stuff. And we focused a lot on like the real names and things. But to take the conversation further, like, once, at least what I've been trying to do is just be honest with them when they ask questions of, now that my daughter is getting older, of like, when I got my cycle back after my second pregnancy, she was, you know, I was like, oh, I need some privacy. Like, I have my period. And then she was like, what's a period? And then she has a lot of questions about, you know, how she always asks, like, how am I part dad if I grew in you? And so I just try to answer like the question that she asks and not go any further. So I'm like, well, you're made of like a sperm cell and an egg. And she hasn't asked yet, well, how does the sperm cell get there? So I just haven't answered that question yet, but try to have those like gradual conversations. And I don't know if you have any like rules or thoughts about like, when do you have these conversations with your kids? Is it like when they're asking questions, or is there a certain age that you should be having this conversation with them before other people tell them?
Yeah, I typically say if they're old enough to ask the question, they're old enough to know the answer. Like, and not like, again, not being graphic. Like, I think what you said perfectly, like, if like, how am I part dad? Or I'm both your and dad's kids. Like, how does that happen? Like, a sperm and an egg come together in the uterus, that kind of thing. Like that, they really don't question beyond that until they're like ready to. So most of the time, if they're like able to ask the question, they're able to receive like a pretty, and I think if you can take some of the like shame and intimacy out of it for yourself, that helps a lot. Because like, if you grew up with a lot of shame, like those questions about periods or babies or things like that feel shameful, but that's not why your kid is asking them, if that makes sense. So if you can kind of like separate that out for yourself, then that really helps you to be able to like educate your kid, because it's not something, I think like the less like sexual it is, like the less also like later on in life, like the less fun it is. Like, you're not gonna, you know, if you're talking about it's not something that's so mysterious. Like we want to do something that's like mysterious or out of like, not something that's allowed, all of those things. Like that makes it more enticing for kids. So I think like the more they know about it growing up, the better able they are to like make that decision for themselves when they get to a point where they're like having to decide on their own sexual ethics. Like, and I think sexual ethics is like a good phrase for that, of like, what do you believe about sex when they're old enough?
Yeah.
When they're teenagers and you're having that like more serious talk about like when they have a boyfriend and stuff, but like, what are your sexual ethics? Because then that can go beyond like just penis and vagina sex. It can be like that opens the door to like, how do you feel about oral sex, or like these are the risks that you take, versus it just being about like, don't get pregnant. There's so many other things to that. Like you're being intimate with someone, you're sharing a lot with someone, which doesn't get really talked about when we're just trying to prevent like pregnancy. So, or like when we're just trying to like shove it down people's throats of like, oh, you're going to want to do this, but you can't kind of thing. It's like, well, now I just want to do it more. So,
yeah. And I'll say that like, I feel like my experience so far, because my oldest is a boy. So, so we have different parts, and he's still very much like in my bubble, in my space. Like when I go to the bathroom, so when I am, on the menstruation part of my cycle, like he's like, oh, what is that? And I've just not shied away from it, because I think that is one of the issues we struggle with now as women, like you said, is it's shameful, and it's something we're supposed to hide, and something we're not supposed to talk about. And that's really hard as a woman, especially when, and if you are in a heterosexual relationship and you are with a man, like that's just part of your life. It's part of your life cycle. And so I've been, trying to navigate that conversation with him. And again, just answering the questions, just straightforward, age appropriately, and not shying away from it, even though internally it feels like, oh, I don't know if I should talk about this, but but I'm like trying really hard to just answer the question and move on and not make it a big deal, because they're not asking, they have no context for those questions, they have nothing. And so it's like just breaking down those walls that have been put up over so much time, and just being like, yeah, this is part of life. This is part of being a woman. This is part of being a man, whatever it is,
Well, and then they have language around, like, if we're looking into the safety piece of it, like they have language around, like if someone has touched them, or if like something happens that they feel uncomfortable with. Like sometimes when that conversation comes up, like if my daughter's asking me a question, I always say like, this is a part that only mommy and daddy and your doctor can touch, and only if you say that we can, or like if you need help wiping, and that's like a good time to say those things, because then she knows she can come to me and say, someone touched my vulva and that I didn't feel comfortable with it, whereas like if you're not using the correct language, it makes it really hard because adults who are doing that to children are incredibly manipulative, and like, not to take it too deep, but that's they're making it so that the kid doesn't want to share that with a parent. And so if that needs to happen, hopefully it never does, but if that conversation needs to happen, then they're able to share that with you way earlier. So, and I see that a lot in adults that never, like, we have a lot of pelvic floor issues that are related to trauma, whether that's like sexual trauma or just emotional trauma, shame trauma, like all of those things. It doesn't have to be like this, like, oh, you had like a very traumatic experience. It's like, oh, I just never knew, like, I'm not connected with that area of my body at all. So I don't really know language around it. I don't know how to describe pain. I don't know how to describe, like, I'm not connected with that area, because it's just kind of like like, oh, I'm not really supposed to worry about it. So
and we see that in birth all the time, of people who just have no understanding of how a baby moves through the pelvis, and what a cervix is, and how a cervix moves out of the way for birth, and like, all those things all the time, that we have so little like words and connection to that. And that kind of brings us into then, if we're talking about pregnancy and postpartum. So when do you see a lot of people coming? I know for me, there was like, it was really hard, which I'm assuming is when you see a lot of people coming in for pain. It was really hard to go from like, don't have sex, always shut things down. Yeah. And then if like I did do things, I felt guilty about it because I wasn't supposed to do those things. It was really hard to go from there to like, then like turning it to being like, oh, now I'm supposed to like be okay with sex and like be, okay with everything. And I'm kind of curious to see if you kind of have people coming in a lot after getting married or in a long-term relationship, or if like pregnancy and trying for a baby and stuff is kind of like something that they seek a lot of help for if they're having a hard time with penetrative sex and stuff like that.
Yeah. I see a lot with like, gosh, it's such a mostly pain, but also, people are trying to get pregnant. And then I always ask about like your clitoris sits kind of within the muscle tissue of your pelvic floor. And so it's super important for pleasure that like I always ask about like if you're able to have an orgasm or if like it's changed at all during pregnancy or postpartum, because it typically does with pelvic floor tightness or weakness or dryness or things like that. But just like kind of backing up, like before pregnancy, I definitely see a lot of like pain with sex, and there's a range with that. Sometimes it's like if you've had issues putting in a tampon, that typically is obviously then doesn't like go away when you start to have sex. Like that vaginal opening is a lot smaller, and so we treat that, and that we have dilators that we kind of walk people through. We have like a dilator program specifically that I made when I went through it, because a lot of there's not really a good like dilator program. It's like put this thing in your vagina and like hang out and wait, which is like not how we treat any other muscle tissue. Like if you wanted to learn how to do like get more hamstring length, we wouldn't just like tell you to stretch your hamstring for 30 minutes. We do like a lot of other things. So kind of the same thing with that, with those dilators. I always make the partner come in also, because typically it's heterosexual couples. And so we talk about the importance of pleasure, and then also like educating their partner on anatomy and like how to help with all of this stuff. So
do you find a lot of partners are like receptive to that conversation, or kind of almost take it like personally?
It depends on the couple. I would say typically those partners either refuse to come in or they don't like allow their partner. I put that in quotations because that, I mean, anyway. They don't.
So usually
like,
the ones that are in your office are people who have partners who are receptive to like getting help and education.
Yeah. And typically once they hear, like, it's almost like once it becomes a medical issue, it's like less of like a, like I feel like a lot of times partners are like, they're kind of have an ego about it a little bit. Or they're like, oh my gosh, she doesn't like me. And I'm like, no, it's just like a medical thing. Like, it's just, and I think that's where, again, kind of going back to like, this all starts with how you're educated as like a child, because if you're educated that like, it should just work when you get married, like that's kind of doing you a huge disservice, because it just, it doesn't, it takes practice and time and figuring things out. So, I think once they like realize like what's going on, I have them like kind of watch the exam and do, everything like that. So that really does help. And then I always have them like, they're also responsible for like doing something while their partner is doing the dilator program. So like while they're doing the dilators, their partner is also responsible for like taking something off their task list or like something like that, just because it's like sex takes two people. So it's not just, especially if you want to have like penis and vagina sex. But there's a lot of other, like, so that's like kind of the most severe thing I see, but then there's a whole spectrum from there, of like issues, or like, all of a sudden when we have hormonal changes, we'll have like difficulty orgasming, or, maybe like certain positions are painful, things like that. So we kind of like do all of that. Yeah.
So I guess let's move to postpartum then.
Yeah.
Let's talk about, unless Ellie, do you have any other questions about pregnancy?
No, I think that all makes sense. I am interested though in postpartum because you
Yeah.
mentioned like hormonal shifts and all
Yeah.
of that, and we know things are just different
Yes.
in
And then
that
when you have like
area
a
after
baby, your
having a
whole life is
baby.
different.
Yeah.
Yeah,
Yeah.
yeah, everything's different. So yeah, I'm totally interested in what you typically see and how
Yeah.
you help women navigate that.
Yeah.
Yeah. How
Pain.
do you see most women like wanting to have sex again at the 6 week window? Or is there kind of like this misconception that you should be like ready to just, just wanting to jump right back into bed at 6 weeks
Yeah.
postpartum?
Yeah, I mean, I would say most people are not ready at 6 weeks. There's like a rare few who like their hormones really shift and they like are wanting to have sex, which is great. But I would say the majority are not like wanting. They're like just overwhelmed or like
Mm-hmm.
tired, all of those things. It might be painful. Um, Sometimes it's painful, sometimes it's not. A lot of times, if we have like any perineal tearing, I usually tell people to make sure to follow up with me before they try and have sex because I can usually like kind of gauge a little bit of like, okay, it is going to be painful. Let's wait another
Mm-hmm.
few weeks. And then they also gives them like permission to wait. Because I think a lot
Yeah.
of times it's like, oh, we get this 6 week clearance, and it's like, okay, we should be having sex, which is not true. And again,
Mm-hmm.
I'm gonna like really overstate that pleasure is the most important. So like, if you just have sex to have sex, because you're 6 weeks, you're probably not gonna orgasm, and that definitely doesn't help with like wanting to have sex again.
Mm-hmm.
So like, if you can have the time and space to like experience pleasure, even if you don't orgasm, but have the time and space to like have pleasure. Vibration helps a lot when the muscles have been impacted. So it feels good, but it also helps the muscle tissue kind of respond. So that like that can help a lot with just kind of like loosening things up and like with the
Mm-hmm.
pleasure aspect. So yeah, I see a lot postpartum. It's a lot of just like giving people space and being like, you don't have to be having sex. You can wait
Yeah.
if you
So
want. And like,
how does the scar tissue usually affect like sex or comfort or whatever? Like what is the scar how
yeah,
does the scar tissue change on like if you have a perineum
perineal
tear, how
tear.
does that
Yeah.
change like the vaginal canal and stuff?
Yeah, I mean, it definitely, if you think about, I feel like C-section scars are a little bit more like external, and we kind of know, like, oh, do C-section scar massage, do that kind of stuff. The same type of scar tissue happens at your vaginal opening. So if you have a perineal tear, you're going to have scar tissue that impacts the nerves that innervate your perineum, and then that scar tissue kind of creates like a little nodule. So it can be super sensitive. It can be, some people scar really well. And so they have like a larger nodule than other people. So massaging that like scar tissue at the perineum is super helpful. So we do that in clinic, and then I can teach you how to do it at home. And it's like desensitizing the area and making sure that scar tissue kind of like heals nicely. Estrogen cream can be super helpful in like allowing that tissue to heal. And with dryness, it's like, going from pregnancy to postpartum is like going from puberty to menopause in like a day. It's like so much hormonal shift.
Yeah.
So dryness really impacts things. I usually tell people if they don't want to use estrogen cream to use like a vaginal moisturizer or something to just kind of like help keep the area nice and soft and lubricated outside of sex. So then when you like go to have sex, obviously please use lube when you have sex for the first time postpartum.
Especially if you're breastfeeding. Gosh, I
Yes,
know
for
like the
Mm-hmm.
sure.
breastfeeding hormones definitely
Yes,
affect
dry everything out. Yeah.
all
So
that.
like
Yeah.
definitely use lube, but then outside of that, also put on like a moisturizer. It's kind of like putting on chapstick. It definitely keeps everything like nice and moist and allows everything to like move and heal better. So
Yeah, totally. Totally.
I feel like
So
I get distracted, so hopefully that answered everything.
no, it's okay.
Go
I'm
off on
asking lots of
tangents.
questions. Do you see people having issues with postpartum sex and stuff from C-sections? I know you kind of mentioned your own
Mhm.
story, but I think that I'm kind of interested to hear like what you see, because I think there is a big misconception about, oh, you didn't have your vagina ruined,
Yeah.
which I hate that term, but I've literally heard people say that before.
Yeah, big eye roll.
Yeah.
So yeah, it basically, if you think about it, you're going through a pregnancy, so like your entire pelvis, like the pelvic floor makes up the entire bottom of your pelvis. So it's definitely affected your whole pregnancy too. So some people will start having pain with sex during pregnancy when they've never had pain with sex before. And it's just because like all those muscles are really trying to stabilize your pelvis with like the added stretch, and like your joints are getting more like looser with the relaxin, and so those muscles really have a lot of strain on them for 40 weeks. So that is a big impact. And then also just like whether you have a vaginal or a cesarean birth. And then when we cut through that muscle tissue of the core when we have a C-section, it also cuts through fascia, which is like a saran wrap that connects from like the abdominal tissue to the pelvic floor tissue. And so a lot of the nerves and like muscles kind of like they engage together and they relax together. And so if that fascia and everything is cut, that does impact the pelvic floor. Like the C-section scar, essentially like everything's kind of like bunching together to heal. So it really pulls on that tissue of the pelvic floor. So that definitely impacts it. It usually with a C-section, we have more like tightness related pain versus like weakness and like obviously perineal scar tissue, which causes pain. So it's normally like those muscles have been stretched for a long time, then they didn't have the vaginal delivery piece of it. And so then they like really contracted back up to like help everything stay stable. Plus we had like an injury like right above them. So everything kind of gets affected. Yeah, it's easier to show you in person, but yeah, everything, it definitely happens, and it's really common. So I feel like that's probably the biggest misconception with C-sections for sure.
Mm-hmm.
Yeah.
It's a pretty traumatic surgery.
Yeah. It's a pretty big, massive abdominal surgery.
Mm-hmm.
Yeah. I underestimated it for sure.
Yeah, I think a lot of women do, and there just is not enough information, because a lot of times when we're having, when women are having C-sections, it is, an emergent or urgent situation. It's not always planned, more often than not, probably not planned. And so it is, there's not a lot of like preparation ahead of time. And then afterwards, it's really focused just on taking care of your scar and how to move in those first few weeks. And there's just not a lot that, of education for what to do after that. So I'm curious. So for women who are postpartum, whether they had a C-section or a vaginal birth, and this really could go for before or during pregnancy, but for those that, when they are ready, there's still like that anxiety there of like, whatever that stems from. Like, what suggestions do you give those women, like, to kind of get back into the swing of things and like a healthy sex life?
Yeah, it's so hard because it's different for every person, but mostly just like giving yourself a lot of grace and time. Like, don't be afraid to just take more time. There's no time frame that's like right. Like, you should be able to have sex at 3 months or 6 months. There's no time frame there. Obviously, like, you want to have like that intimate relationship with your partner, but there's other ways to do that. So like working on like intimacy with your partner outside of like sex is super important. I refer to a sex therapist a lot, which people kind of get weird about, but it really is helpful. Just, it's like basically like couples therapy, and then you get to talk about sex and intimacy, which is extremely helpful because it could like, there's typically like a huge shift in like responsibility, like task division. So like that plays into it of like whether or not you want to have sex. There's just like other factors. And so like don't like not pushing through it is huge because we have direct like research evidence that like if we push through things that does not help your sex drive or your marriage in the long run. So like taking 6 months to a year postpartum to like get back to having sex the right way is going to be way healthier and better for your marriage than if you push through at like 6 to 12 weeks just because you think you should be or because you think it's going to impact you in this moment. So I think that's like the biggest thing. If I can like tell anyone postpartum anything, it's that like don't just like take the time to really make sure you have pleasure, you and your partner are in like a healthy spot, and like why you don't want to have sex. Is it fear? Is it pain? Is it because you don't feel attracted to them anymore? Is it, like what's going on there?
You have a crying baby that needs to nurse every 2 hours.
Totally.
Yeah.
Just feel like disconnected from your sexuality at the moment.
Yeah. Touched out. Like, I think a lot of women tend to feel, especially if you're exclusively nursing or whatever, just feel touched out or things feel different. Like, your nipples might not feel the same, like it's just, things are just different. And there's a lot of other, like, I think, anxieties about like, am I going to be able to relax because is the baby going to wake up or start crying and need me? And then there's that like maternal like response to your baby's cries and stuff like that. And I think that's really hard to navigate for a lot of women. I love that you incorporate partners into appointments. Do you typically do that also for postpartum appointments? Because I know that a lot of times in heterosexual relationships that there is a disconnect between what your partner feels you should be doing, and then there's pressure, and they don't necessarily understand everything that's happening with you and your body, and sometimes that's hard to talk about.
I always encourage people to bring their partners with them to sessions if they can. A lot of times postpartum, it's hard because their partner is usually taking care of the baby so that they can come to the appointment. So it just kind of depends. But there are times when I'll see someone postpartum, and if we're like specifically working on sex, or especially if we need to do dilators postpartum, like that's a lot. That's kind of a time commitment on top of like, taking care of a baby. So then I'll say it's like super important for their partner to come in and make sure that they like schedule a time where they can have childcare. But I always encourage it. I would love if every session we could do partners. Cause I mean, most people, if women don't even know where their clitoris sits, like men definitely don't know. So it is extremely helpful. I like definitely go over that, and I'm like, if we're just kind of like rubbing on the outside, like that's kind of like rubbing on the inside of your leg, like we're not getting to the good stuff. Like it's not going to really be that helpful. So go over some important points for sure. And other things.
Yeah, I think postpartum, like you said, just like giving yourself time and space to feel attracted again, to like not attracted to your partner, but like feel like you want to have sex again, and you're not just because it takes time to adjust to your new role as a mother, even if you've already had kids before, and it takes a lot of time to get back to that version of yourself. Like you said, some rare times women just feel in tune with their sexuality shortly after birth, but most of us are having this huge identity shift that is just like on the back burner. And I know, going back to purity culture, that's a huge thing for those who grew up in the church, of feeling like you have to have sex with your husband a certain amount of times or he'll like stray or have wandering eyes, or like things like men are sexual creatures, which I just hate. It's like women are supposed to be sexual creatures too, but like
exactly.
Why, and so anyways, I think that that's a huge thing that you have to work on to like give yourself permission or change expectations in your relationship of being like, it's not, if you weren't going to have an orgasm, we wouldn't be having sex. So like, I should also only be having sex if it's like for my pleasure, because then it's just going to continue to disrupt our sexual relationship if we're not doing it for the pleasure of both parties. Like it's going to ruin things more like down the line, like you were talking about, of that pain, you know, cycle of like then not wanting to do it because you have pain with it and stuff. So I think that's a huge thing that a lot of people need to give permission for. I remember I made a postpartum with my second baby about returning to sex postpartum on TikTok, and a lot of people were commenting how they had sex before the 6-week window, and a lot of them sounded very like it was like a pressure thing of like I have to kind of thing because my spouse or my partner wanted me to, and that makes me so
They've
sad.
been deprived.
So sad. Yeah. 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 It's so sad because it's like that is like a medically she should not be having sex. So like the fact that you're pressuring someone into that, like I don't know. That's like I would need them to take a long look in the mirror about that.
Yeah,
like,
and I think for some people there's not a lot of education as to why there's the 6-week wait. You know,
Right, exactly
which
what I
is
was
a
gonna
problem.
say.
Yeah, yeah, because it's like I think once people understand, like I truly haven't encountered, like most people want to have sex with a partner who like is not only consenting but excited about it. Like most of the time, it's like you want that like reciprocal relationship. So if you can just like educate on that, like this is what leads to that, like they're like, oh yeah, we'll do whatever we need to do, you know. So but yeah, and like I kind of backtracking a little bit, but I always say too, like sometimes I know I said like never push through, but there are some times when it's like, okay, maybe I just like need to be asked or like told I look beautiful, and like if I just like kind of like there's that mental shift of like, okay, if I put myself in this mindset, I think that I can like have pleasure and like experience that. Like, am I just tired and do I just need to be like, okay, yes, I can do this and like orgasm, or is it like this will actually put me over the edge and I can't do it right now. So yeah, totally. But that's a hard balance, and you kind of have to know yourself and your partner too.
Yeah, which I think is so great that you refer to a sex therapist and stuff too, because lots of times it does go outside, you know, these problems. Some of them are just physiologically like related to the injury of birth, and others are a lot of times it's all tied together of like our body. I mean, we see that in birth too, of like our body is like our body responds to what our thoughts are. Like if we have fear, we're tensing, and then our body isn't progressing, like our cervix isn't opening because we have this fear of the pain and of the birth. And I feel like it's so similar in, well, we lots of times say like what gets the baby in gets the baby out, like in birth, of like you have to feel safe, and in a, you know, you like darkness, and you like to only be around the people that you trust and feel comfortable around. And like that's so similar between birth and sex. And I think that there's just not that there's a lot of disconnect people have from their bodies and their sexuality and all of that. So
totally. Yeah.
Let alone with a partner, like for themselves, they're disconnected, and then you add a partner on top.
Yeah.
And I think a lot of times when we say that, people just think like positions, because that's a lot of times when we talk about that, like when we say that, but
we're like, hey, this is how I got pregnant when we get them.
But it is so much more. It's so much more than that, especially in the postpartum phase. Like there's so much more of that emotional factor.
Yeah, and me and Joe, if you listen to our episode that will be 2 weeks ago when we talked about fair play, like we didn't talk about sex, but we were like, I said to him, I was like, can you give a case to like why people would want to do this? Because pretty much it's like, you know, if you're thinking about fair play and shared invisible workload, it's like for men a lot of times that's just them taking on more work. And like he said, like it really has helped our relationship and our household just be more enjoyable and more pleasant, and we have more capacity for like enjoying time together, no matter if that's sexual or just, you know, emotional time together. And so I think that that's so much the case in sex too, especially postpartum. Like you have to create space. Like if she has just had the baby on top of her for hours a day, and then you're asking her what's for dinner, like she probably doesn't have a lot of like mental capability to also think about like having pleasure in that evening. So
Yeah. Have you heard of the book Come As You Are? Or have you read it?
No, I haven't. I read another book though that you suggested. What is
Oh,
it?
nice.
What was it called? It's the one about purity culture.
Oh, The Great Sex Rescue.
Oh yes, I
Yeah,
love
that
that
one's
book.
really
I
good.
read that.
So
It,
good.
it's a
So
lot of
good.
things I already knew, but like it was amazing to like read about it and just like be like, oh, this is a shared experience.
Yeah.
But
Yeah.
sorry, you go ahead and talk about Come As You Are.
Oh no. Come As You Are is it's about there, and then she just wrote another one called Come Together. But Come As You Are is kind of about female pleasure and like how it works and everything. And she talks a lot about like gas and breaks, like what are your breaks during the day that like would limit you from having sex or like wanting to have sex, and then what are things that like are like gas, like makes it easier for you to have sex.
Yeah.
So that sounds a lot like what you were talking about. I just
like,
oh, that's perfect. You just yeah.
Yeah, totally. Well, some good book recommendations. Yeah, I would very much suggest The Great Sex Rescue to anybody who relates to me and Bethany, of dealing with kind of like purity culture, lots of shame around sex, and then now trying to navigate that as somebody who's married and in a in a relationship. And I have to say, like,
such a good book.
Yeah, and like if you do the work, it can get better. And I think that there's this misconception, especially again, just because the only thing I know is purity culture. Like that's the only way like I grew up. So there's this huge misconception of like there's a lot of people who say like, oh, if you save yourself, then sex is going to be so like God will reward you with a great sex life and marriage. And that's so untrue. Of like sex takes work, of like learning about each other and understanding each other, and like it progresses over time if you're putting in like the work and energy to be better and to be more enjoyable for both parties and everything like that. And I think that that book is really, really great for talking about all that.
Yeah. And it just contributes to the shame cycle. Like I see so many people in here that are like, well, I know it's supposed to be better in marriage, but like I did have this one time that I like, I don't know, whatever they find shameful that they're like still holding on to because they think that's why they're having a bad sex life in marriage. And I'm like, oh no, like this is just, it's just so hard because you're like, this is not like, this is just your muscles are tight, which is just because of all the shame you've experienced, not because you, I don't know, had like a sexual experience at prom, I don't know. Like I just,
yeah, totally.
That's a lot.
Well, thanks so much for coming on, Bethany.
Oh my gosh, thank you guys. It was
this was
fun.
so good. Is there anything you want to leave our listeners with? Like one last final thing?
Gosh, I mean, I think kind of like what I said earlier, just really give yourself some grace and like time and prioritize your own pleasure.
Go in and see a pelvic floor PT. I encourage anybody to see one, even if they're not having problems around that 6 week.
Totally.
I know for me with my second baby, I just always shout this from the rooftops now because I almost had a prolapse but didn't quite have a prolapse at 6 weeks. And when I went to see my pelvic floor PT, she was like, you didn't come in and just went right back to normal exercise. Like you probably would have caused a prolapse to happen. And it's so important to just get assessed, just like, if you got major surgery or like got in a car accident, like you would go to physical therapy and get like assessed for function and everything like that. It's so important, not just for sex, but just for your life and everything, being able to function as a mother and live life to the fullest. So
totally,
for sure.
Love that. Well, you guys are awesome. It's such an honor to talk to you guys.
So. Thanks for celebrating Love Month with us.